Good. Yeah. Okay. All right. Wonderful. Well, good afternoon, good evening, depending upon where you're living. Welcome to Gutsy Gathering. I am so incredibly excited about this topic today. Advocating for yourself, self-advocacy. I feel like this is a topic that we can continuously talk about. So today we're going to have Charlotte and Sarah. This is me. I'm just here to welcome you. But we'll have two speakers that will just share and help give more information about self-advocacy and what that means and how you can support yourself, give you maybe some more tools for your toolbox to help you advocate for yourself. Because I think regardless of who you are or what your experience is or where you are in your own healthcare journey, we all could use some more information on self-advocacy. So in regards to questions this evening, if you have any questions, we'll do questions and answers in the end. It'll just be an open discussion. If you don't feel comfortable asking your questions, you can definitely put them in the chat box and I'm happy to read your questions, or one of our speakers can read your questions, however you would like to communicate. But we welcome questions in the end. So with that, I'm going to hand it over to Charlotte.
Absolutely. Hi, everybody. My name is Charlotte Rensberger, and I'm one of the patient coaches with 11 Health. And one of my almost all-time favorite things to talk about is self-advocacy. It's something that's near and dear to my heart because not only am I a Crohn's disease patient who has a permanent ileostomy, so I call myself a professional patient, but I am also a healthcare provider because I work as a nurse practitioner. So all of the concepts related to self-advocacy are just something that's intertwined into my life in every encounter I have with another human being, pretty much. And I am joined by Sarah Skoda, who's going to help talk to us a little bit about how you can manage that kind of shutdown that happens when you experience a mental crisis. So I'm going to go to the first slide. So what is self-advocacy? So a lot of times we think about patient advocacy in the realm of, well, I volunteer for this organization, or I did a 5K for this organization, I wear this t-shirt, this kinds of things, but we fail to see that the key of advocacy is the advocacy that we can have for ourselves. So self-advocacy is the act of speaking up for yourself and your rights. So in this realm, we're talking about it in the medical perspective, but there's so many more ventures of self-advocacy. But for this talk specifically, we're going to talk about it in the medical capacity. So it's with the intent of improving your quality of life, affecting your personal change, and or correcting inequality. And we refer to it as the ability to put your needs into words and then to be able to convey those words to other people to get those needs met. So some examples of self-advocacy are things like asking for clarification before you sign a consent to have a medical procedure done. Asking for a second opinion if you don't understand the recommendations that someone has given you or you don't agree with those recommendations. Asking for pain medication before it's offered, or asking for a loved one to remain at the bedside with you during your care. Those are all things that you can request and that are part of your rights as a patient as you're receiving health care. Next slide. So why is advocacy important? It's really important because healthcare is complex. So you can't always treat the same diagnosis the same way for every patient. Patients are complex. No two patients are the same. And so what worked for one patient may not work for another patient. Outcomes depend on it. So both your outcomes as a patient and your experience, but also outcomes as a hospital functions in relation to their funding and their patient outcomes. And then it's something that's mutually beneficial. So advocacy, if I advocate for myself as a patient, it improves the care that the provider is able to give me, but it also improves the outcome that I receive as a patient in relationship to my health as well. Next slide. All right, so the Patient Bill of Rights. So the Patient Bill of Rights was something that was first adopted in the 1970s, and it was kind of a brainchild of the American Hospital Association, and it's kind of been like revamped a couple of different times. And not every hospital's or healthcare institution's Patient Bill of Rights is the same. So each little institution will have different nuances to their Bill of Rights, but the key features of a patient's Bill of Rights is that you have a right to communication, you have a right to informed consent, you have a right to confidentiality and patient privacy, you have a right to healthcare access, you have a right to not be abandoned, you have a right to refuse care, and then there's all your legal rights that come along with it too. So they developed this with the expectation that healthcare institutions would support these rights in every action with the interest of providing efficient and equitable patient care, is the bottom line of it all. So next slide. So what does this really mean to me as a patient? Well, the first thing it means is that you should have a voice in your story. So your story doesn't have to be, well, I have this diagnosis and here's what the doctor says about it. That conversation between you and your doctor is going to greatly impact the outcome you have as a patient. So you need to be very present in those interactions with your doctor. Speak up, and speak up loudly if you need to. An example of this is that my dad was recently hospitalized, and he put a call light on for pain medication, and 45 minutes later still did not have the pain medication. And I said, if you're in pain, you need to put the call light on. He said, I did 45 minutes ago. I said, okay, well, you need to put the call light on again and say, I called out for pain medicine 45 minutes ago and I'm still waiting. Because I know as a nurse that in the time that he put that call light on, another patient grabbed me in the hall, or a patient's family member grabbed me in the hall, or the phone rang, and then I had to go back to the computer and answer a question that the doctor was asking me. So I know that not every time there's a delay in care like that is it something that's intended. Sometimes it's just a byproduct of the care that happens in a nursing unit. So not something that's malicious intent at all. So I said, it doesn't do any harm to put your call down and say, hey, I asked for pain medicine 45 minutes ago and they're still not in there. Could you please let them know that I'm still waiting? Because I guarantee that nurse was like, oh, geez, I got cut off. I was on my way in there and I just didn't even know it. You should be an active member in your healthcare relationship. So the relationship is your care team, your loved ones, and yourself, and you need to be active in that, not passive. And then the other thing that it means to you is that there are times in your medical journey where you will not physically be able to advocate for yourself. You need to make sure that the people that are there caring for you know your wishes. And so this is not necessarily just an end of life care. An example in my case is that when I have pain, typically Dilaudid is not a medication that works well for me. And so 9 out of 10 times, Dilaudid is one of the first meds they give you after surgery. So it's up to my husband, who knows my experience with Dilaudid, to tell the medical team, in the past she hasn't liked Dilaudid, could we start with something else for her pain control? It's going to work much better for her. But he knows that. I've designated him as that person for me to advocate for me when I can't do it for myself. So I alluded a little bit in the last slide to the healthcare relationship. So the healthcare relationship is something that has been a cornerstone of healthcare. And in 2017, there was a survey by the Council of Accountable Physician Practices, and they found that in their survey results that consumers or patients believed that the patient-provider relationship was the single most important factor in their care and their healthcare outcome. So then I started thinking about, okay, well, what is the healthcare relationship? And the Cleveland Clinic is one of the foremost institutions in the United States for patient advocacy and this healthcare relationship. And so they define the healthcare relationship by the elements that are required and not required. So it's required that you have an emotional connection with your provider. It's not required that you're friends with them. It's required that you have a mutual respect, but that doesn't mean that you agree on everything. It's required that you guys have genuine interest in your outcome, but that doesn't mean that they can spend an unlimited amount of time with you at every visit. It's required that you have a patient perspective and psychosocial context, but it's not required that there's a toleration of boundary violations. And then there's required shared commitment to a positive outcome, and it's not required that a provider is asked to practice outside their usual scope. things like some providers may be comfortable with you having their home phone number. Some providers may not. Some providers may be willing to have contact with you outside of the office on weekends, outside of normal hours. Some providers will not, and it's okay. So with that being said, every encounter that you have with a provider is only as good as the information exchanged. So it's our responsibility as a patient to provide accurate information in whatever context that comes in. So symptoms logs, food diaries, timelines of when things happen, what testing I've had done, what I experienced. Who are the members of my care team? I've taken care of patients before that have the same prescription written from 3 different doctors. That's not safe, for one, and also something that kind of leads me to believe, are there certain doctors in that care team that are operating without knowing the full story of what's going on with their patient? But did they not know that because the patient didn't give them the information, didn't provide them the right information? And then it's your responsibility to provide clear expectations and goals, because not always can a provider meet your goal, because what if your goal is unrealistic? So that conversation needs to be had. But it's the provider's responsibility to make sure that they're asking the right questions to get all the information needed to get a clear picture of really what's going on with your situation. It's also the provider's responsibility to determine if additional information is needed. So maybe that requires different diagnostic testing than what's already been done, or additional diagnostic testing, or maybe a diagnostic test that was done 2 years ago now needs to be repeated, because we can look at the difference and figure out whether or not things have changed in those 2 years. It's the provider's responsibility to outline next steps and possible treatment options. And it's also the provider's responsibility to align expectations and goals. So it's my responsibility as a provider to say to the parent of the patient I'm taking care of, I understand that you said that X, Y, and Z was your goal, but that's not going to be reasonable in the next 3 months. But it may be reasonable in the next year, and we'll have to work our way up to that. But aligning those goals so that my experience or my expectations that I'm coming to you for as a patient line up with what really can happen in our healthcare relationship. And I could talk about this subject for an hour, but we're not going to do that because I don't think everyone is as crazy excited about it as I am. But if you only remember 3 things, there's a really nice program that the Institute for Healthcare Improvement made called the Ask Me 3 program. And it points to 3 questions that patients should ask their providers to help understand their conditions and what they need to do as a patient to stay healthy. What is my main problem? So this is, what is my diagnosis? What is going on with my body? 2, what do I need to do? Is there additional testing that needs to be done? Is there medications I have to take? Do I require surgery? And 3, is it important for me to do this? And the opposite of that is, what will happen to me if I don't do this? So with any medical procedure, there is risks, benefits, and alternatives. So you need to know, if I choose not to take this medication as prescribed, if I choose not to have the surgery that's recommended, what is the long-term effect that could happen if I choose not to do those things? So here are some great online resources about patient advocacy. The Psychology Today is one of my favorite things because I really think that they break it down in a way that is super easy to understand as a patient, and especially as a patient going through medical crisis. It is not always easy to be on that side of the bed and organize your thoughts in a way that really makes sense to be able to tackle standing up for yourself. I think back to post-operatively, sometimes when I've been in so much pain that the only thing I can do is focus on breathing. And so I can't focus on the things I need to focus on to advocate for myself as a patient. So I really hope that, just knowing this information about the rights that you have as a patient, if you haven't seen them in the hospital institute that you work with, please request them, request to talk to somebody about them or see them. They have to post them. They're there. I'm would be surprised if they're not something that you had encountered during your care so far.
Okay, I think this is me.
It
Um,
is.
Hi, everyone. I'm Sarah Skoda. I am caregiver to my mom, who's right here next to me. Mom has an ileostomy now for about 4 years. So we've been with 11 Health for a couple of years. I know some of you already know me, so it's great to see some familiar faces. But I think a lot of what Charlotte was saying, especially with psychology today, I really like that you use that, because I'm going to talk about psychology today also, what a wonderful resource it is. But I think when we're dealing with any sort of medical situation, medical crisis, our emotions are certainly a factor that is also something that comes up. Also, just the fact that even when we're not in a medical crisis, we're dealing with COVID all around us. I think we're all kind of going through some sort of mental shutdown, mental reaction to things. So I think before any sort of a medical procedure that might be scary or concern that might be having, it's important to understand what your body is doing also to your emotions. So if we go to the next slide, we're going to talk a little bit about mind-body connection. So a lot of times we think that our physical health, what's happening on the inside with us physically, doesn't necessarily have an impact on our emotions. And maybe we think it doesn't because we might feel okay, we might think it's okay, and we don't realize just how much there is this mind-body connection and how much our brain actually reacts to stress. So to understand a little bit more about that, whenever emotions are triggered within us, it is connected very strongly to our endocrine, nervous, and immune system. So anytime there's some sort of a stressor, like an upcoming surgery or something like that, our body creates a stress response. A lot of times it's known as fight or flight, and you'll hear that terminology sometimes when you hear about stress, and our body will have this reaction. So what actually happens is that a stressor occurs and the amygdala, a part of our brain, actually perceives it as a threat, and it reacts. It starts to trigger a signal to the hypothalamus, which then talks to the command center of our brain. And then it starts to communicate to the autonomic and nervous system. And then that's when the physical symptoms start to show up when we're feeling stressed. So if you've ever had any sort of a physical symptom like sweating, I know sometimes I can get like dry mouth, if I'm really feeling very stressed or overwhelmed. Your heart rate increases. So there's definitely this connection of when we're experiencing a stress, our whole body is reacting to it. So our body is in this state of fight or flight, and it doesn't recognize that, that there isn't maybe a fight or flight around us, but it's reacting within us as if there is something really major happening, and then we're reacting to it. So it certainly then worsens conditions that we may already be struggling with, like autoimmune diseases, more anxiety, hypertension, diabetes. It will only exacerbate those types of struggles that we might already have. And that's why it is so important to understand this kind of reaction and connection to how our body is dealing with the information that we're receiving, whether it's from a doctor or we know we have this upcoming surgery and it's creating things for us. Or like I know for us, it was really challenging when Mom had her surgery because it was so unexpected. It was, kind of came out of nowhere. We didn't know. One day everything was okay. And then all of a sudden she was coming home with a stoma and we had to figure out this new life. And so our bodies, I think, were in this state of fight or flight for actually quite some time, both Mom dealing with this new impacted way of living, and then also for us as her caregivers to understand how best to support her and help her. And so we were all impacted emotionally, and without realizing it, probably having some sort of internal physical reactions as well. I know there are times I thought, oh, I'm fine, I'm doing okay. But what I realized after after things kind of settled was that my anxiety had increased, and I was certainly struggling. And so I needed to take a minute and start taking care of myself as well. So it's really important no matter what is happening. And I know now, especially, I think we could all benefit from understanding mind body, because we're all being dealt with such a difficult situation in the world around us with COVID and everything. But certainly when you're dealing with any sort of a chronic illness or a major surgery, it's really important to understand how much our emotions are actually playing a role. And when our emotions play a role, it will affect us in ways, and then it can even impact on us advocating for ourselves, like Charlotte described, because we might be having trouble understanding what's happening for us, that we can't vocalize some of the struggle that we might be facing. So we can go to the next slide. So this is just a little chart about kind of how our brain handles stress. I know it's a little hard to see, but anytime there's any major event, the brain is reacted. We have a response to it, both behaviorally, physiologically, and just everyone has a different way of dealing with it. And then we also will either adapt to a situation, or many of us might reach this allostasis stage, which is basically more physical reaction within our body and more, I don't want to say damage, but it can be damaging, because if it's going to, worsen our blood pressure or things like that, those are things that certainly we need to be aware of. So certainly staying in this allostatic place is not a healthy place. So we have to learn how to adapt and cope and be able to then move through the process in order to be our best advocates for ourselves. I'm just seeing if I have anything else. No, I think we can go to the next slide. Thank you. Okay, so positive thinking. We've all heard about the power in it. I think that there is so much to be said. I think especially when you're faced with a difficult situation, it is one of the first things we might do is think negatively about it. I know my first thoughts when mom was getting surgery and everything was happening was negative. I wasn't thinking like, this is all going to be okay. We were scared. We were really having a hard time dealing with all of this. So our thoughts certainly can facilitate stress responses in our body. So without even realizing it, the amount of thoughts we have all day, which are about 1,000, depending on if you are more a thinker or not. I know I'm a thinker, so I might even have more than 50,000 thoughts a day. I think a lot. And one negative thought can ruin that entire day. So it's just so important that, with that many thoughts in a day, that one negative thought that we tell ourselves can take us from being okay to really not feeling okay, and then triggering a stress response within our body. And as you can see, that connection, that mind body, that circle of life, how it happens to us. So really being aware of our thoughts and how we're saying things to ourselves in a state of crisis or a medical emergency, just kind of remaining as best as we can calm and trying to be as positive. And I'm not saying that we need to kind of be like, oh yeah, the world's great, everything's great. When things are hard, we need to acknowledge that too, and we need to say that. But it's just important to recognize what we're saying to ourselves, because I understand that the world is going through a difficult time right now, and that's okay. And we're working through that. That's very different than this sucks, this is terrible, this is never going to be over. Those are two very different types of thoughts. So it's really important to understand how we're saying things to ourselves. So we talk a lot about self-care. It's one of the things that I think, especially more recently, like that's all you hear about on the news. Is like, we have to take care of ourselves. We have to take care. Go take a bath. Go have a glass of wine or something. Which is lovely if that's part of your self-care. But what we need to understand is that self-care is ongoing, and it's actually a state of action. It's not really just the, oh, I'm going to pour myself a glass of wine tonight. It's actually a constant checking in with your emotional, mental, physical needs. It's always being in tune to those things, because when we're in tune to those things, we're much more aware of even how to vocalize those things. So going back to then advocacy for yourself, when you're in tune to your mind, body, and just everything that's happening, you're going to be able to find those words to verbalize to your doctors or to someone what might be happening or what you're concerned about, or not feel bad to, ask a question. I know for the longest time I felt always bad asking questions. Like, I was like, oh my God, I'm going to ask questions and they're just going to be like, she's annoying. She's asking so many questions. And I realized that wasn't getting us anywhere, because then we were just more stressed about it because we still didn't have the answers to things. So not asking the questions was not benefiting mom or me. So I needed to learn to take a minute, think through my own thoughts, what was happening for me, and then not feeling bad asking the questions and just saying, this is what's happening. I'm confused. I don't know this. We've never done this before. I've never heard of this. Can somebody explain it to me? And once we started asking those questions, I realized that people were willing to answer them, which was great. So it wasn't this scary thing. People were willing to help. They want to help. So certainly always asking for help is so vital, but we have to be in a state of okay to look for help, I think. So we need to always check in within ourselves and understand our own thoughts and processes and ask for that help. So yeah, the first step is always to ask for help, and to not feel ashamed in it. Even if it's just like, I am feeling super emotional lately. I don't know why I have been feeling this way. I don't know what to do. Ask that of your care providers. I'm sure that they can guide you towards some sort of an idea of what could be happening for you. And maybe it's just that you aren't as aware or informed of something, and they can give you some more information. So it's really important to remember our thought process through difficult moments and crises that we face, for sure. And I think the longer that we are aware of our thoughts and become more in tune to how we're saying things to ourselves, the more we start to prepare ourselves for any type of difficult situation that we might have in life, whatever we encounter. I think that will benefit us so much. I know the more I spent time focusing on that for myself, the easier it became when I would go to doctor appointments with mom to ask questions or look up information and get back to a doctor with more questions. I felt more confident to do that because I had kind of switched something within myself to say, it doesn't have to always be, this is the worst thing possible, this is the end of the world. That was only doing me damage and mom damage, and we weren't getting anywhere with that. So I needed to really kind of flip that switch within myself and know that it was okay to ask for things. And moving forward, I think I've gotten definitely much more comfortable with my thought process around everything that mom goes through medically. I ask the questions, and I try to write things down. I mean, I'm always taking my notebook to appointments with her. So certainly that is something that all of us can benefit from, for sure. So I think that leads us to the next slide about a little bit about just kind of developing techniques that can help us also with our positive thinking and staying positive, and also when we're in a crisis situation, kind of what to do. Charlotte had said breathing, that when she, was in a situation, that's all she could do was breathe. Breathing is the best thing that we can do in any sort of a situation that we're feeling overwhelmed or feeling pain or in a crisis. We should breathe. And we don't realize that oftentimes we actually aren't breathing. as much as we should be. You know, we are taking maybe small breaths and we're not taking those big deep breaths. So there's this great technique of tracing your hand, which will help you with breathing. So it basically works like you trace your finger up, and as you go up, you breathe in. And then as you go back down, you breathe out. Then you go back up and you breathe in. Then you go back down and you breathe out. So when we're in this state of crisis and you know, it's hard for us to think positively or anything, and the only thing we can focus on is breath. And if we're having trouble breathing, I think the hand technique is wonderful to help us through those situations, because we might not remember how to do anything else, but if we can remember our hand right here is always with us through everything, we can remember how to do the tracing technique to help guide us through breathing. So it's one of the best things. I can't take credit for it. I, you know, was stumbling upon some research for anxiety for myself. Actually, was just doing some research and I found this and I was like, this is a great tool. People need to know more about this. So I'm sharing that with everyone because I do think it's so powerful to have that. And it's something that we can take with us everywhere. You know, the bubble baths are great, but the bubble baths are not going everywhere with us, you know, but here's our hand. So let's learn how to trace the hand and do our breathing techniques to kind of stay calm through a crisis. Another really great technique is the 5-4-3-2-1. I do this a lot with my students that I work with in my school when I'm when a lot of them might be in the middle of a panic attack of some sort. I tell them to, you know, acknowledge the 5 things they see, 4 things that they can touch, 3 things that you can hear, 2 things you can smell, 1 thing you can taste. When you think of those types of things and you're working in your senses, you're able to get grounded again. And oftentimes when we are feeling stress or anxiety or we're in a crisis situation, we kind of like disconnect from ourselves, you know, you know, like we're almost like it's like out of body, right? We're kind of seeing things in this out of body experience, or we get a brain fog. And then when we start to tune into our senses, it helps to get us grounded and back to the present moment, and not so much this kind of out of body experience that we might be feeling. So that really helps us. And sometimes it's hard to remember 5 things you see, 4 things you hear. So even if you can do 1 thing you see, 1 thing you can touch, 1 thing you can hear, 1 thing you can smell, 1 thing you can taste, all of that is very, very helpful. So even if you don't remember, oh wait, I have to remember 5 things, that's like more stressful. Now I have to remember 5 things, 4 things, 3 things. You don't necessarily have to, you know, be that precise about it. You know, when I'm working with my students, it's obviously a different situation because I can, you know, look at the paper that I might have it written down on to remind them about it. But sometimes even when I'm just kind of, you know, with myself, and I need to do this, I don't always think 5-4-3-2-1. I might think like, what can I see? What can I touch? What can I hear? What can I smell? What can I taste? And I have to say that's something that I know I've also benefited from. I get very anxious prior to my own medical procedures and things like that. So 5-4-3-2-1 and breathing have always helped me in those situations, to make myself feel more comfortable before I get into a situation that might feel really anxious for me. And then always sleep. It's hard. I know we lose a lot of sleep recently. A lot of us probably haven't been sleeping much. That just means that our mind body is certainly in overdrive right now. But sleep is so important to our bodies and our minds. And we need to try our best to get as much sleep at all times, because sleep deprivation only adds to all of what I talked about, you know, the emotions, the physical reactions. It'll only just make those that much worse. So it's so important to sleep. And when you are especially thinking about, like, you know, having an upcoming surgery or something like that, trying your best to make sure you get good sleep before you, you know, lead up to it is so important, so that you're well rested on that day and that you feel, that you're able to really hear what the doctors are saying and all of that. So I know that's hard because it certainly is anxiety provoking. I know when I had surgery 2 years ago, and I got very anxious beforehand, and sleep was hard, but I tried my best to kind of like get as much of rest as possible prior to the morning of my surgery, which I think did help. I mean, I certainly was still anxious, and I tried my breathing and, my coping techniques to help lessen some of that for myself. But definitely sleep, I think, overall in our lives is very, very important. I mean, those of you that might have children know when you're sleep deprived, it's that much harder. You're only that much more stressed or irritable or something because you haven't been getting enough sleep. So it's so important to get sleep. And I think we can go to the next slide. Yep. And last and finally, just some resources. I love to give out resources. I think they're so important to have on hand when we need something maybe more for ourselves, when we're looking for help. And especially our emotional health should be just as important as our physical health. So sometimes we might need to seek help for it, and that's okay. There is nothing wrong with that. So seeking help with a therapist is always great. You can always call your medical insurance. They will have a list of providers that accept your medical insurance. So that's a way to find a therapist. You can also use Psychology Today. So as Charlotte mentioned, it's a great resource for a lot of things, including finding therapists. It's such a great site to look up therapists based on zip code, and you can look at profiles and find someone that matches your kind of what you're looking for, what you need. I know that I have sought out my own therapy often throughout my life. And the last time I went searching for a therapist, I did it through Psychology Today, and I loved how they had it set up. So I certainly encourage everyone to use that as a resource. And it's okay to look for a therapist and look for help. I think we're starting to see the conversation more and more in the country being about how it's so important to take care of our emotional health. I think following the COVID situation, it's going to be certainly more of a topic of discussion. I think everyone's being impacted in some way emotionally. So seeking help is all right. And just know that confidentiality works in that setting too. Nobody needs to know that you're going to see a therapist. There are HIPAA laws that protect you as well when you are seeing your therapist. So if you're worried, like, oh my God, my family members are going to know, whatever, if you want to kind of keep that, to yourself, that's totally fine, because therapy is yours and it is your own private place to meet with someone. But certainly, if you feel comfortable sharing that you are getting support, it's always good, because I think the more we talk about how it's okay to get support, the more people will want to get support. So, but certainly I understand that sometimes our situations are very challenging and we may not want others to know, which is okay. So therapy will always keep that safe. HIPAA works just in therapy as well. Then there are some great online resources. I mean, one website I always refer to is NAMI, the National Alliance for Mental Illness. They have great resources. Sometimes they do different presentations and things like that you can watch directly on their website. It's wonderful. We've brought them into my school to do presentations for our students to talk about depression and suicide and things like that. And they're a really wonderful resource out there. And then there's the National Suicide Prevention Lifeline. That's a really great resource because it's a 24-hour line. So there's someone that will always be there. And one thing I want everyone to know is you do not need to be in a suicidal crisis to call this lifeline. You can be just dealing with anything emotional and just having a tough time and want to talk to someone. It is okay to use that resource for anything. You do not need to be, thinking of suicide or anything like that to call. You can just be feeling really sad or really down or really anxious, and you will get a counselor on the other line to help support you through that. It was mentioned to me the other day that people didn't realize that that was something they could utilize, not in a suicidal crisis, but it is, and it should be a resource for everyone. So so whether you are just kind of feeling really down and overwhelmed, you can turn to that anytime that you need to. So I think that's all for me, actually. Yeah, just these resources. Always, good to look for some support and help.
Thank you both so much. So we can open it up for questions. If you guys have any questions, like I said before, you can feel free to ask the presenters questions. If you want to put them in the chat box, you can. Both are totally equally acceptable on here. I did get a question that was sent to me, and I'm going to present it. I think it's such a good question because this was part of maybe something that even wasn't touched on, but I know probably people really do feel. So what about and for you, Sarah, you're a caregiver, but if you see that your caregiver needs some mental health support or they need to take some time away, right? So like, I'm sure you're so committed to your mom and supporting her, but if you know that that person that's supporting you needs a break and they need some time away, but they don't want that and they're refusing it, how can you get them to step away from the stressful situation and take a break and maybe get some support that they need?
So I think that there's a few things that factor in there. So certainly, firstly, forcing anyone into therapy is not always effective. They're not always going to go. They're not always going to want to go. They're not going to follow through on the appointment. So first step is you can always encourage them by saying you'll go with them, that you think, the both of you can do it maybe together. And there are therapists that will meet with kind of families. So there's that way. But if the person you care for is just really refusing, even going into some sort of a family type setting, I would say start with the doctor. Sometimes when we hear it from the medical professional, it hits differently than when we say, I want to take you to a psychologist, because there's still this stigma that exists. I see it within the families I work with, where my students might be ready for therapy, but the families aren't, and I try to get them to their pediatricians first. And a lot of times the pediatricians and doctors these days are really working on also the emotional health part. So that's a great way to kind of ease into the discussion, and then hopefully when they hear it from their medical professional that it could be beneficial, that could be something that you could then encourage. So firstly, certainly going together to see someone, starting with the medical professional if that person really doesn't want to see anyone at all, and you can see if that'll encourage. And then ultimately, if the person really, really still refuses, you really can't drag them. So then what I would say is the caregiver should just seek out their own support, and go to therapy for themselves, and just kind of learn ways and techniques that can help them manage the situation at home, and hopefully see if maybe that can start to kind of normalize things at home for the person that might be needing the help that really isn't seeking the help. So I think there's different ways you can approach it, and I think it all depends on the person that I guess how much they're really held firm to not wanting to get any sort of emotional support.
Mm-hmm. Yeah, that's all really good advice. And I love the avenue of really connecting with your doctor and having your doctor support that. I know from my end and where I was in nursing, it's not uncommon for patient families not to really see what patients want, and because there's emotion tied in, right? And so sometimes really, we don't always see things the same way. So really having that come from the physician, I think, could offer a little bit more support to the patient, but a little bit more power to the family and that patient's support. So I have another question that came through the chat box to me. Maybe probably for both, but Charlotte, from your side especially maybe, but what if you're feeling like you're not being heard from your care provider, how could you effectively communicate that you're not being heard and that and then also moving forward, how can you make sure that not only you're saying I'm not feeling heard, which I think is important, but then how do you communicate your needs?
Yeah, so I think there's a couple different ways to answer this question. I think the first thing is, as a provider, I have never been stopped cold in my tracks more than when a patient or a family member has said, I don't think you're listening to me. I think even just saying those words out loud are going to cause pause, and it should. But I also would empower a patient to involve multiple members of their care team. So I think it's completely appropriate if a physician or a provider leaves your room and you don't understand, to then say to the nurse, hey, I didn't really understand what they said. Can you tell me what your interpretation of that conversation was? Or can you tell me what you think about that? Also, the people at your bedside, like my husband, I will often say, did I just hear that right? Is that really what they said? And so definitely utilizing all of the people that are kind of involved in your care. And then if you're really feeling like you're not being heard and that it's impacting your ability to be well and to get better, all hospitals have some sort of department. At my particular facility, it's called patient relations. And that's a number that you can call at any time and say, hey, I'm inpatient on this unit. I don't feel like I'm getting good care. Here's why I don't feel like I'm getting good care. What are my avenues? And the thing that I always try and tell people when they're making those kinds of complaints is that I understand that your healthcare is emotional, but it's important to be factual in those sorts of situations. So saying the example, I never get pain medicine when I want it. I'm always in pain and they never help my pain, is not going to mean as much as if you say, at 2 o'clock on Wednesday, I put my call light on and I didn't get pain medicine until 3:45. And for that hour and a half, I was miserable and no one answered my call light. Those are the kinds of things that I think it's really important to kind of not take the emotion out of it, but it's hard to rein those thoughts in when you're experiencing something that's so emotional. And so I think really trying to organize your thoughts in a way that it doesn't feel like you're attacking, but that you're honestly saying, I had this need, I vocalized this need, and my need was not met in a timely manner.
Great. Thanks, Charlotte. I'm going to ask one of my own, actually, maybe to Sarah. You mentioned that you got to a point that you kind of just like, I guess you could say, just going to translate your words to like, you just didn't care anymore about like how many questions you asked or what they thought. And I think that that's so, maybe it was like very pivotal for you, but I feel like that's a very hard thing to get to, especially if, I think for many of us, maybe even here, for me as a nurse, I think that there's this assumption that like, well, you're in the healthcare field, so you should know. So I'm just going to skip over a lot of that. And maybe for a lot of patients here who have lived with disease for so long, there's that automatic assumption of like, well, you've been here, you've experienced this, and there's that kind of skip along. So how do you get to that point that you kind of like get past that and just open up the gates for questions and that comfort of that all?
So, it certainly was not easy. Personally, it took me a lot of my own just kind of like self-reflecting and letting some of the I carry a lot of guilt. I think it's like especially like amongst like women, it's like we carry guilt, and I always feel like guilty and bad and all these things, and I have to learn to let some of that go. So it was a lot of my own internal work. But one of my biggest things was the notebook, where I wrote questions down, and then when I sat down with the doctors, I would always say, I have questions to ask. And then, I'd have it written down, because I know a big part for me was if it wasn't written down and I would say I have questions to ask, I'd forget what all the questions were because I was so nervous or whatever, flustered, and I didn't know what all my questions were. So then I just had the list, and then I'd go over the list. Even I do that for my own personal self, that even one of my doctors is like, oh, now it's like, oh, you got the questions? And I'm like, yes, I have the questions. So I think that, when we are feeling maybe not as comfortable or confident, or we do get flustered in the situation of being with the doctor and knowing that they might be limited on their time or whatever, come with your questions there. And I think that has helped then make things a little more smoother for me. That's what I would recommend. Write the questions down.
Very helpful. Unless anybody wants to jump in, I'm going to keep going with questions that I'm getting.
I have a question.
Yeah.
Well, it's not, I guess it is a question, but I wanted to kind of get really anybody's advice on this. I know personally, working as a nurse in the COVID ICU here, it's not a requirement, but I try to video chat with Google Hangouts with our family members, because we're not allowed any visitors unless it's an end of life patient, and they're allowed one visitor and maybe two, but usually not. So I try to video chat with the families at least once a night, because I work night shift. And then I ask the family member if they want me to call them when I'm getting done with my shift, to kind of give them like an overnight events kind of thing. That way, they wake up in the morning with a little bit of peace of mind about what the day's going to bring. And, I try to ask them, like, what kind of music does your family member like to listen to? And I try to play it. Whether or not that's going to either make them hate that music in the future, or if it makes them happy, I don't know, but it makes me feel better. I think it makes the family feel better. But so I see this every day at work. And so what I'm struggling with, my husband and myself, we had to put my father-in-law in a nursing home this year, and he's only 70. But we basically had to carry him out of his house in New York and bring him to North Carolina, take him to my hospital. He was dehydrated, had a UTI post knee surgery, and he's just it's kind of been his demise. And he unfortunately is in a nursing home where there's a couple of COVID cases. We have not been allowed to see him since January. We can only do window visits, which we do every week. We bring our dogs. We try our best, but he's not eating. He just keeps talking about wanting to die. And just really, he's in a very dark place. And he's on Medicaid. I know there's not a whole heck of a lot out there, unfortunately for that. I've tried to ask about video chatting, and they're just so short-staffed that they really can't do the things that we can do in the ICU, or at least are not willing to try. And so my question is, how do we make it so that he feels like we are advocating for him, but also that we're here for him? And are there any other ways that we can reach out?
Yeah, I think that's really hard. I think that, we're in this kind of state in our pandemic where I honestly don't think administrators really know what is the best thing to do to protect patients, as well as, have that balance of like mental sanity that we all need, right? And I think if we could solve that problem, we would make millions over the next 6 months, because I don't think it's going to get better quickly. I think that everything that you've tried is great. I could only wish that if I had a family member that was hospitalized, that you would be the nurse that's caring for them and providing all of those little peace of minds, because I think across the United States right now, a lot of hospitals are bare bones and they really can't afford to do those things. So that's awesome that you're able to do that. And I recommend and commend you for that and encourage you to keep doing that. The only thing that I can recommend as far as like kind of helping your father-in-law know that he's still loved and cared for are visuals. And so things like a Build-A-Bear that you can record your own voice into. Sometimes you can get those talking books like in the Hallmark store where you can like record yourself reading the book. I mean, a lot of times those are geared towards kids, right? But it's also having that memory of your voice and that connection that just kind of may help get through these next couple of weeks. And I don't know how tech savvy he is, but even having a recording that he could listen to on an iPod or an iPad or something like that. But I know Build-A-Bear does those recordable voices because we do that a lot for the kids in the hospital. And there's books that you can get, I know that you can record on, but I wish we had a magic way to get rid of COVID because I do think that, and unfortunately, you know, I have a couple of good friends who are administrators in nursing homes and you know, and they're like, you know, we can't even go see our family for the holidays because I want to protect the old people that I take care of. And I owe it to them to stay healthy so that I can take good care of them. So yeah, I think it's just, unfortunately, it's just something that we haven't encountered before, and so we don't know how to really approach it.
Thank you. I appreciate that.
Yeah, you're welcome.
Not long ago, he was able to, like, we bought him a simplified laptop where he loves to watch sports, every channel, everything. And so that was kind of keeping him going, was watching all these sports and streaming and all that stuff. And we got him a simplified iPhone to video chat. But I don't know if there's like something that happens to your brain if you're stuck in a room for so long, but he just is such a decline that he doesn't remember how to answer a phone anymore. And this is just over the last few months. He's never had this issue. And same with he doesn't even remember that he has the laptop there. So and we can't go into like open it and open up all the programs and everything. So do you suggest, like, would it be appropriate for me to be like, hey, do you have any staff available that I can help walk through turning this on for him because he really needs this and he doesn't really know how to do it? Or is that like overstepping?
Oh, no, I wouldn't say that's overstepping at all. I would say that you feel like that's something that your father-in-law needs in order to like gain health again and be able to function, and that's something that he needs. I would say it's a necessity. And I wouldn't hesitate going to administration and asking for that.
I think so too, right? Because it's part of his health. Like it's his mental health and it's part of his health, and that should be supportive there. So yeah, connecting, I think somehow, and getting. I know, like we had gotten a family member in a somewhat similar situation, like a refurbished iPhone, so that we could FaceTime and connect. And sometimes I think. You know, maybe if you could like send him some things that were maybe from his home, that could be like a physical connection or a memory. Those are great things to, connect to. Danielle, thank you for sharing. I know it's tough. These are tough situations, like, and very unique. This isn't something that we've ever really navigated through before. I'm gonna end on one last question because I feel like it really does connect, and it was one of my questions, and then I got it through the chat, so I'm just gonna pile them together. Sarah, like, how do you trigger your mind when you're like to switch that negative mindset when you're in crisis? I mean that, and I know I'm asking. It was my question because when I feel this build and I feel anxious, I have thought building myself, and sometimes it's hard, when you're in that crisis mode to like stop those like negative thoughts from negative thoughts, and when you're in crisis, it just continues. So any suggestions for how you can just hit a stop?
I think when you're in crisis, it's hard to, you know, switch into a positive mindset. I think that this is stuff that you want to build for yourself before a crisis arises, and you want to like kind of make that more natural habit for yourself. It's like that cognitive behavioral structuring that we need to do to kind of swap that. But as I said earlier, you know, you're like, you might still feel those negative feelings, and that's okay, because these are difficult moments. And I think it's just that spiraling that we're, you know, trying to avoid happening when you're in a crisis. So I think in the moment it's really hard. So in the moment, maybe just kind of focusing on breathing, those other techniques to just kind of help calm some of that is really important. But positive thinking is something that takes time to really build up within yourself. And it's always like work that we're doing for ourselves, like forever. We're always going to be working on it. Yeah. I know I'm still always working on it, you know?
Yeah. Yeah. Great. Thank you guys so much. Thank you both to our speakers. This was so valuable for things to put in our toolbox for advocating and getting through crisis. Thank you so very much for joining us. Guys, I'll have a wonderful rest of your day or evening or night. All right. Goodbye. Thank you again.
Thank you, everyone.